Edutainment Studios welcomes you to Alzheimer's disease. This module is part 4 of a 4-part series on Alzheimer's and is aimed at helping you have a better understanding of the disease. Alzheimer's is a disease of the brain and is the most common form of dementia. This disease affects memory, thinking, and behavior that is not typical of normal aging. It will progressively get worse over time. In this course, the objective is to help you apply ways to make daily living easier. Daily routines can help someone with Alzheimer's function better. As the caregiver, planning a routine will require experimenting with different ideas and making adjustments along the way. When it comes to bathing, you may find that they will resist any help when it comes to bathing or dressing themselves. This can turn into a real challenge, but there are some things you can do to make the process easier. Start by making the bathroom warm and having everything ready to go. Be gentle and respectful of their dignity by using a light blanket or towel for privacy and warmth. Sometimes a sponge bath is easier than getting them in and out of a shower or bathtub. Always provide safety by using a tub seat, handrails, anti-skid mats, and handheld shower heads. When it comes to grooming, it would help to label the grooming items and keep them in one specific place. Provide enough time for them to get ready so they don't feel rushed or pressured. Keeping their hair in an easy-to-care-for style will avoid a lot of headaches and frustration. Encourage them to use an electric razor when shaving and to brush their teeth twice a day. As the disease progresses, be on the lookout for warning signs that they can no longer drive in a safe manner. Gradually switching them from the driver to the passenger seat will work better than suddenly cutting them off from driving at all. There may also be transportation services in the area for seniors who cannot drive. There are some warning signs to watch for to help determine if they are getting to the point where they should no longer drive. Pay attention to the following: any scrapes or dents on the car, garage, or mailbox. Incorrect signaling. Parking inappropriately. Confusion between the brake and gas pedals. Stopping in traffic for no reason and getting lost when traveling to familiar places. Escorting someone with Alzheimer's to and from the store and to appointments is the best way to ensure their safety. The doctor can also recommend and provide information on a driving evaluation. Some people with Alzheimer's become more confused or agitated later in the day. This is what is called sundowning. If this seems to be the case with your loved one, inform the doctor, who can then evaluate them for any medical issues that may be causing this problem. To help ease some of the sundowning symptoms, make sure they are getting plenty of rest. All activities should be scheduled in the mornings and provide a quiet environment later in the day. Watch for any triggers that may set them off and try to avoid or eliminate them. At this time, Alzheimer's disease has no definitive cure. Any medications that are currently being utilized to help treat Alzheimer's disease only temporarily slows down the damage. The FDA has approved a few drugs to help with the treatment of Alzheimer's dementia: rivastigmine, galantamine, donepezil, and memantine. These drugs can be taken both individually and in certain combinations to help with mild, moderate, and severe symptoms. There are other potential treatments and possible strategies that are being used to help treat Alzheimer's, but there is no definitive proof of the impact of these on the disease. Please feel free to investigate these sites and others for more information, and remember to bring any concerns or questions in to discuss with your doctor. Thank you for joining us today for part 4 of this 4-part series on Alzheimer's disease.